All right, we're on your side with health news this afternoon. Over 200,000 men in the U.S. are diagnosed with prostate cancer each year. And for more now on prostate cancer, we're joined by CBS 47's medical expert, Dr. Dave, and another study that confirms some things we've already known.
That's right, Mike. Good afternoon. Prostate cancer is most commonly treated with surgery, radiation, hormones, or a combination of these three. And a new study shows that men with prostate cancer localized to the prostate gland are as likely to survive with observation as with surgical treatment.
So jumping into the treatment immediately may not be the best thing to do.
That's right. There are three things that men can know about observation for prostate cancer. The first is, what is observation? In this study, the men were observed with doctor's visits every 6 months and a bone scan every 5 years. Another similar approach is called watchful waiting, done in older men, where your doctor waits to start treatment until you develop symptoms. And a more aggressive approach is called active surveillance, seen in younger men, where your doctor closely monitors your PSA blood test, your digital rectal exam, and does repeat prostate biopsies to start treatment regardless of whether you have symptoms. Number two is, why is no treatment offered to men with prostate cancer? This is because in some men the prostate cancer can be slow growing at an early stage, putting them at low risk for having disease outside of the gland. In certain men, their age or other medical factors may be more likely to affect their life expectancy before the cancer. And for some men, the side effects of treatment are more troublesome to their quality of life. And then finally, number three is, who should choose observation, watchful waiting, or active surveillance? No treatment is not good for every person.
Right.
There are risks to not having treatment, including missing the opportunity to treat an early stage disease, your disease progressing outside of the prostate gland, and then the anxiety of not having the treatment. So it's a decision that you want to make closely with your doctor, your radiation oncologist, or your urologist.
People think of this as a disease that affects older men, but you mentioned younger men in there too. It can creep up on you.
The biggest risk factor for prostate cancer is age and then family history, and we typically think of older men as older than 65 and younger men as younger than 65, but screening for prostate cancer begins as early as 40.
40. Okay, that's the key age to remember there. All right, Dr. Dave, thank you.
You're welcome.
Dr. Dave joins us every Tuesday right here on The Noon Show, and if you have a specific question or a topic you would like her to consider discussing, email it to us at newsdesk@cbs47.tv.